Hi, everyone, and we are live. So, today is day 4 of the Autoimmune Symposium, and we had a lot of great talk today. So, we had talks from Margaret Berry, Dr. Nam Lee, Dr. Kelly McCann, and also Dr. Felice Gersh. So, mast cell activation syndrome is one of the things that I see in my clinic, and it's a condition that can be very, very frustrating for a lot of people. Mast cell activation syndrome has patients that deal with a lot of different rashes, hives, brain fog, fatigue, headaches, joint pain, muscle pain, and there's so many different symptoms that come up with mast cell activation syndrome. Based on my experience as a clinician and a doctor, when I see patients that have mystery illnesses that have seen 10 doctors sometimes it could be mast cell activation syndrome. And I have quite a few patients with mast cell activation syndrome in my clinic, and they have lupus, rheumatoid arthritis, or other conditions as well. One of the ways to treat mast cell activation syndrome is, of course, there are two ways: supplements, herbs, and medications. With medications for mast cell activation syndrome, you can use the antihistamine medications such as Claritin, there's Zyrtec, there's Benadryl, and also when you're done with those, you can use Pepcid, you can use Singulair, and also ketotifen, and also cromolyn sodium. From the supplement side, you can use supplements that help with allergies, so quercetin, stinging nettle, turmeric, vitamin D, fish oil, phosphatidylcholine, and also glutathione can also help with those as well. And also with acupuncture can be so useful as well. The flow of qi is real. However, it's hard to measure that at this time, but patients do get better with acupuncture, which is why I brought Dr. Nam Lee on today's talk. It's because acupuncture can work. I've seen it work in my patients for pain, for headaches, for many different conditions. And the philosophy is quite different from Western medicine, but a blend of Eastern medicine and Western medicine can be so powerful. And also hormones as well. Hormones are 2 times in a woman's life that I see more autoimmune diseases, and that's in menopause and after delivering a baby. And the reason why is because both times the estrogen levels drop in menopause and as well as right after delivering a baby. And sometimes putting patients on bioidentical hormones can help the patient with their autoimmune condition. And Dr. Felice Gersh is an expert in this field. She's one of the thought leaders in integrative OB-GYN, which is why I want to bring her on to talk about progesterone, testosterone, and estrogen levels as well. So there are so many things that we can do with autoimmune diseases, not just take medications. And it's beyond sometimes just taking a different diet. It's about supplements, about herbs. It's about looking at the nervous system. It's also about looking at the hormonal system and also looking at different conditions such as mold, Lyme disease, and also mast cell activation syndrome as well. Sometimes I see all these in one patient, and it can be so challenging to treat. And we have a question. Can you please discuss the effect of high estradiol on JIA? I'm not sure if high estradiol has been studied in JIA because it's usually in, patients under 18 years old. However, you do want to avoid xenoestrogens. So xenoestrogens are coming from environmental toxins, so such as plastics and parabens. These are xenoestrogens that can raise and mimic estrogen levels in the body. So that's why they talk about excess estrogen in the body. So that's one of the ways that you can get sometimes hormonal imbalance in the body through these environmental toxins. And diabetes can also contribute to inflammation as well, which is why we want to minimize all these other comorbidities. So, which is why having a good diet, having a good lifestyle can help with diabetes. So that's why we want to avoid refined sugar as much as possible. because it can contribute to diabetes and thus lead to more inflammation in the body. So whether you have lupus, multiple sclerosis, thyroid diseases, rheumatoid arthritis, you do want to avoid diabetes as much as you can. And you want to avoid having excess weight as well, because the excess adipose tissue or fatty tissue is hormonally active and can contribute to inflammation as well. And I am so excited for you to see more talks tomorrow, Saturday, and Sunday. So coming up tomorrow, we have Jason Prawl. He did a documentary on the blue zones. The blue zones are the places that people live the longest in the world. So he's going to be talking about that as well as the nervous system. And Dr. Ailey Cohen is a rheumatologist. She recently wrote a book called Detoxified, looking at environmental toxins and the immune system. So I'm excited for her to talk to you about environmental toxins and detoxification. And we also have Sandra Curtis talking about leaky gut and nutrition, as well as Jane Hogan, who is not only a patient, but she's also a coach as well. So she has a great insight into rheumatoid arthritis and autoimmune diseases as well. So there's a lot of great talks coming up and on the weekend as well. And I made 2 new YouTube videos this past week that's going to be released next week. It's about mast cell activation syndrome. It's a complete overview of mast cell activation syndrome, which is the 2 newest videos coming out. And stay tuned. I'll be coming with a podcast soon enough in the next couple months, and lots of great, exciting courses and educational content for you all. And will there be a replay? Trish, that's a great question. So there will be an encore weekend next weekend. That's what my marketing director told me. And if you want to buy the course, not the course, but if you want to buy the whole summit, it's only like $60 or $70. And you can buy the whole thing and watch it at your own leisure and have a lifetime access to it. But there will be an encore next weekend where you can watch all the videos within 2 days if you have that time. That's a lot. But there will be an encore weekend for those of you that couldn't watch it live this past week. So I'm so excited for you to see the rest of the videos. It's going to be a comprehensive foundational piece to autoimmune disease. And when I make the course, it's to go into much deeper detail on these different topics. So there'll be a DIY course where you can do it yourself and go through the foundational pieces, which I will be teaching. And there'll be a more intensive course where I'll be going live with group coaching about once a week to go into detail about stress, diet, environmental toxins, and so forth. So I'm so excited for you all to keep watching this content. Thank you so much for the support. Oh, there's another question here. Bep, Mom, you asked, I have osteoarthritis and rheumatoid arthritis and low vitamin D. My joint and body are in a lot of pain. How can I get rid of the inflammation? Great question. So getting the tips from this week's summit and symposium can help you get more ideas on how to remove the inflammation, and also watching my other YouTube videos. I've made a lot of YouTube videos on diet and inflammation already, so be sure to watch those videos. I made them probably a year or 2 ago, but they're still relevant today. And I'm going to be making more videos on inflammation coming out in the near future. So I'm so excited for you all to join me this evening. I still haven't eaten my dinner. I ate half of my dinner and I had to go YouTube live. So after this, I'm going to go eat and finish my dinner and talk to you all tomorrow. Oh, I'm going to finish. There's 2 more questions here. Oh, 3 more. Okay. So Jennifer, you asked, have you worked with patients that have both knees stuck bent at almost 90 degrees and no movement in them? If so, if there's ways to help with that. So that depends on the reason why they're stuck. Is it because of osteoarthritis? Is it because of rheumatoid arthritis? Or is there a mechanical issue going on? So it depends on the reason why it's stuck. And that will lead to different treatment plans, such as maybe steroid injections, diet, and other things. So sometimes it's a combination of treatments that can help. JCS, I need help with long haul COVID. It's my understanding that this is a post-viral syndrome and also nervous system disorder affecting mitochondria. Any suggested supplements? Yes, I made a long haul COVID video. That was my most recent video, I think. So be sure to watch it. It's like 16 minutes long. I put all the supplements in there that you can use to help with long haul COVID. So be sure to watch that. I put a lot of time into that video. So there are a lot of I probably put like 10 supplements in there. So be sure to watch that video, okay? JCS. Scott, you asked, my doc is trying to force me with Skyrizi. For psoriasis, will high vitamin D3 help at 100,000? You need to talk to your doctor about the vitamin D amount, but that's a high vitamin D amount. I actually don't suggest going on that high vitamin D. You can actually overdose on vitamin D, so be very careful. Jennifer, you said RA osteoarthritis. So if it's stuck because of inflammation, you need to look at every viewpoint, diet, nervous system. You may even need to take medications as well. Even though I am a holistic rheumatologist, I still use medications when it's needed and to kickstart the anti-inflammatory process so my patients can get better enough to exercise and move around and eventually taper off the medications if possible. Yeah, JCS, yeah, it's my most recent video. I think it's the last one or one before, but it's 16 minutes long on long haul COVID. It's like 20, almost 30,000 views on it right now. So be sure to watch that. Bet pump. I also have FND. Can this be the cause of the arthritis? FND. Let me see. What do you mean by FND? What is FND, guys? I don't know what FND is. Functional neurologic disorder. That's what you mean. I don't know if functional neurologic disorder is the cause of arthritis. It's usually not. They're two separate issues. Allison, I have RA and don't want to take medications. When will I know when I really need to take anything long term? So when I work with my patients, I talk to them and decide and figure out whether they're in severe pain or not. If they're in more minor pain, they have more time to not mess around, but work with alternative medicine. And then, but they're severe pain, I put on medications and then I try to taper them off, depending on the situation. There's no one perfect way of treating this when you combine alternative medicine and rheumatology together. Proctitis treatment without medication. I don't know about proctitis treatment without medication. There's creams you can put. Certainly, there's antispasmodic medications possibly you can use. Definitely anti-inflammatory diets as well can be very useful. Do you work with patients from other states? If you go on my website, I'm going to put it on here. It's drlifestyle.org. That's my clinic website. I just wrote it down here in the chat box. You can see that I'm licensed in 15 states where I can prescribe medications. If you live in a state that I'm not licensed in, you can always fly to see me one time a year in California. I live next to Disneyland, so you can fly in, go to Disneyland, and see me at the same time. And then I can prescribe your medications and see you virtually for the rest of the year, and you come back every year to keep that doctor-patient relationship going. If you're outside the United States, I can also work with you as well. I just can't prescribe medications. So I have patients who fly to me from other countries like Germany, Australia to see me, establish that care, and then go back to their country. And so they can get all the functional and integrative lab testing done and get some medications to go back to their country. What is a 17.4 reading in RA? I don't know what that means. There's so many labs in RA. So I don't know if you mean lab or what you mean. But it was so nice to talk to you all. I'm going to finish my dinner. So it was really nice to talk to you all. Keep watching the summit. I'll be coming out with a course soon so we can all be part. We can work more intimately together. Okay, so I can answer more questions in the future. So nice to meet you all. Thank you so much for the support. I'll see you guys again tomorrow morning. Take care. Bye-bye.